So in terms of drugs, there aren't many things that have any evidence-based medicine behind them at this particular point in time. One of the things that I always say with any horse with laminitis, and it's not just because Dean, for example, is in the audience, but when it comes to the management of a horse or a pony with, certainly with long-standing laminitis or repeated episodes of laminitis, a farrier is of more use to you than a veterinarian. It hurts me to say that about anything. But when it comes to the care, it needs to be a team approach that involves the veterinarian and the farrier. But the long-term care of the feet of a horse with chronic laminitis, you really do need an excellent farrier. There's no two ways about that. And we're lucky to have such people in this area. It is very important, which can sometimes be a difficult thing to achieve, to increase their physical activity. There's obviously a balance if they're sore-footed. You should not force a sore-footed horse with laminitis to exercise. But horses that are easy keepers, horses that you're trying to get weight off, horses that have this particular problem, once their feet are comfortable, you must exercise them. It's the same as, for example, type 2 diabetes. Sometimes the body condition and the other health issues make it difficult for people to exercise. And the same thing can happen with these ponies and these horses, but when they are sound enough to exercise, then they should be. We really want to target 2 to 3 hours of exercise a week as a minimum for those horses and ponies. And it would be better if it was a little bit more. Don't immediately go to 3, 4, 5 hours of exercise on a horse or a pony that's never done anything before, or not much for several years, but work them up to really try and achieve several episodes of 20 to 30 minutes and more, so that they're getting at least 2 to 3 hours, if not more, exercise a week. This bottom thing here, where I put no pasture, is, as a veterinarian, often the hardest thing to get people to buy into, because it's cheap food, and the horse or pony loves it. But it's the very worst thing for them. Horses and ponies with EMS should not have pasture. And we battle with that because it seems so unfair, it seems so cruel, and it creates more expense because you've got to pay to feed them if you don't use the pasture that may be available free of charge. But they should not get it, because as I said several times earlier in the talk, pasture has a strong association with it. So it seems like you're being cruel, it seems like we're doing something to them that they should never have done to them, but if they have a diagnosis of EMS confirmed, then pasture is in their past. It's not in their future or present. Nutritionally, that's where we're at in terms of trying to limit calorific intake and to help try and get some weight off them. So they should receive grass hay fed at no more than 1.5% of their body weight. So that's basically 1.5 pounds of hay per 100 pounds body weight, and that's grass hay. It should never include richer leguminous hay. Sometimes that hay can be, there are many places around this country where you can get hay analysis done for what's called non-structural carbohydrate content. 10, 15 years ago, there were very few horse owners that ever got their hay analyzed to the extent that people do now. There are a lot of labs that fairly cheaply will provide you with what's called the NSC content, and for a horse with EMS, you should be targeting an NSC content of less than 10%. That's really an indication of structural carbohydrate, the hot part of the food for them that generates the glucose levels that's inspiring the insulin levels. If you, if you didn't know this, just to warn you, if you allow ad lib hay in ponies and horses, which many of us do, particularly at certain times of the year, if you allow them to eat as much hay as they like because they seem to like it and you can afford to do so, many ponies and horses will eat 3 to 4 times as much hay as they should be getting with this particular syndrome. So it seems draconian. People look at you, and even if they do believe you when I give that suggestion for a horse that's in the hospital, we often get a call a week later or a follow-up call that says, we couldn't possibly do what you said, I felt so cruel. The horse was constantly hungry, it was miserable, it's a quality of life issue. Well, the quality of life issue is sore feet for the rest of the horse's life or the pony's life. So that's the bigger issue that you're trying to counteract here. So it is important that you cut their feedback in a draconian way. There are a large large number, again, if you do an internet search, there will be a large number of additives and supplements that are touted to be effective and to help with equine metabolic syndrome horses. Probably amongst the ones that have got the strongest following are chromium and magnesium, and then there are some perhaps more natural type remedies like chasteberry and cinnamon. There isn't any evidence-based medicine to support any of them, but I will tell you that I don't think any of them do any harm. They have been borrowed in some instances from human medicine. There's probably more veterinary support for magnesium and chromium than there is for some of the more natural things. But in reality, there's no proof that any of them make a difference in these horses. If you are feeding hay and you cannot, or you will not, or don't wish to have the non-structural carbohydrate content analyzed, one of the ways you can reduce the carbohydrate challenge to your horse or pony is just soaking it before it's fed. Now, this time of year, that's not popular because it ends up with haysicles, and you try and soak it. But soaking the hay, not just dousing it with a hose, but soaking it for a minimum of 6 to 8 hours, so overnight, which is miserable in January and February around here. But if you soak it for 6 to 8 hours and then drain that water off, so get a garbage can and do it in that, then a lot of the real hotter part of the carbohydrate component in the hay will come off with it. So it makes regular hay a little safer to feed to these horses if it's soaked for 6 to 8 hours first. There are a large number of supplements and other things that, as I said, are being touted for use in these horses, but it is very important if you're soaking the hay in particular that you do supplement the horses with vitamins and minerals, because a lot of what you'll do with that water helps from the perspective of EMS, but will also leach out some other things. So make sure, and many people do anyway these days, regardless of whether they soak hay, but have a mineral vitamin supplement as part of the diet for these horses, because again, if they're having their hay soaked, then you will lose some of that content. I think in the next decade or so, there will probably be more and more effort to try and provide these horses with supplements, nutraceuticals even, that might improve insulin sensitivity, and there are active areas of research in that. There are some short-chain fructooligosaccharides that have been looked at in Europe that actually do improve the glucose metabolism and insulin sensitivity of these horses, but that's a field in its infancy at this point in time. Occasionally, some horses, when you try and get weight off them with this condition, they do what you want and they lose weight, but sometimes they lose too much. So if ever you're in a situation where you're trying to maintain a slightly higher body condition, you're wondering, well, how can I do that in a horse like this? Because I've been told so many times and I've read so much that I shouldn't do that with sweet feed or cereal grain-rich diets. Then the way to get more calories into them is through fat. That's a safer way of doing it rather than through cereal grain carbohydrates. All right, those, you may not be able to see them at the back, those are the links. This is the website that has the consensus statement, that has all the information that you might like about equine metabolic syndrome, and these are two really good websites to help you body condition score. So regardless of whether you're doing it because you suspect EMS or something else, it's a good idea to body condition score your horses from time to time. Again, I don't want to eat into Corinne and Dr. Kolb's time, so I will be around at the end, and you're welcome to ask me any questions, and then copy